Welcome to Health Professional Radio. I'm your host, Neil Howard, for this Health Suppliers segment. In studio with Dr. Alvin Berger, and he's joining us here on the program to talk about the benefits of Delta 5. Welcome to the program, Dr. Berger.
Yeah, thank you. My pleasure.
So, who is Dr. Alvin Berger?
So I have a master's and a PhD and a postdoc all in lipid, nutrition, and cell signaling. And I've been studying fat for the last 30 years for both very large companies like Nestle and Cargill and also smaller companies. I'm also an adjunct professor at two universities in the nutrition department, and I'm still very passionate about trying to combat chronic inflammation.
Did you found the company as well, or have you come on board recently?
I founded Skiadonics Incorporated 2 years ago, and Skia Essentials, just to keep it straight, is a wholly owned subsidiary of Skiadonics to sell products directly to consumers.
So these products are all based in reducing inflammation?
That's correct.
This brand new development, Delta 5, what exactly is Delta 5 and how is it beneficial?
So technically, Delta 5 is when the first double bond, counting from the carboxyl end of the fatty acid, is in the fifth position. And so you can imagine a structure like in skiadonic acid. It's 5, 11, 14, icosapent trienoic acid. So to remind you of this systemic nomenclature, icosa means 20, and tri, of course, 3, and ene is for the number of double bonds. Okay. And the double bond positions are at 5, 11, and 14. So that's technically what a Delta 5 is. And realizing that consumers and most technical people probably won't care much or understand what I just said, we decided to try to brand it around Delta 5, much like omega-3s. I mean, how many people really understand what an omega-3 is, but they know it's good for you? So we're trying to educate people that Delta 5 is something new and unique and with potent biological properties.
So what properties, what are some of these combinations, some of these compounds that you've been dealing with?
So the skiadonic acid has been tested in cell models and in various preclinical models and also in pilot work in humans so far. And the kind of properties we observed when we used animal models were in mice, for example, a mouse model of lupus, the mice lived longer, did not develop spontaneous tumors, had reduced double-strand DNA antibodies, a hallmark of systemic lupus erythematosus, and improved glomerular filtration rate in that model. In other models, we saw reductions in inflammatory markers, a reduction in fat mass. In models looking at the skin, we saw reduced edema in it's a mouse erythema model. Mm-hmm. So we saw some nice benefits there.
Now, as far as some of these models are concerned, when it comes to human benefits, what types of tests and things have you done or are you going to do?
So what we're planning to do much more human clinical work. So far, what we have is mostly it's data on individual medical doctor friends of mine or doctoral friends of mine who have tested it on themselves and also their family members. But I will say that we've looked at the skiadonic acid levels in people that did not consume our products just to get a baseline. And we found in looking at 1,000 people, the levels to be about 0.1% in the bloodstream. So this fatty acid is made endogenously just in small amounts. But to your question about what we have observed in people, in these technical colleagues of mine, it started with a gentleman in Denmark who complained of interdigital fissures on his hands, meaning there are cuts between the fingers and they would not heal. So he applied the skiadonic acid oil, which we call Delta 5, topically. And then I got an excited email and phone call saying the cuts had healed. So a very rapid healing was observed. And when we heard that report, we realized that we had something special. So we've gone on and tested it in palmar psoriasis of the hand, We've given it to someone that had osteoarthritis of the hand, who applied it topically and reported more mobility and less pain. We've observed significant and rapid reductions in redness from rashes, and we've seen reduction in acne. So basically, because we understand the mechanism of action, which is reducing arachidonic acid and other pro-inflammatory mediators from specific lipid pools, the kind of conditions where we're seeing these improvements are those same conditions where we know that these inflammatory mediators are involved in the etiology.
What about the delivery of Delta 5? Does it matter on the condition that you're addressing as far as inflammation, the delivery of these compounds, as far as intravenously or orally?
Well, for oral use, most fatty acids, including skiadonic, are highly absorbable, typically 90 to 95 or more percent. Mm-hmm. And the fatty acids are present in traditional triglyceride form. And what we've observed in the models is that it's absorbed like any other common fat. Okay. With respect to the question about potential future injection and other uses, it's worth noting that it has a quite good oxidative stability. Mm-hmm. It behaves like oils that have just two double bonds in the main fatty acids, like linoleic, which is in sunflower oil, for example, safflower oil, and these kind of oils. So a quite good stability, showing at least 1 year stability or more. And that's very important when we start talking about formulations, whether it's for the drug industry or the food industry. And with respect to topical, right now we're seeing pretty good penetration just with the oil as in a triglyceride form. We've not yet maximized the oils for the most, for maximizing the penetration potential by using penetrants and surfactants and possibly using not the triglyceride form, but perhaps ethyl ester forms.
When it comes to these essential fats, are we not getting them in our diets? Can we use diet to supplement the benefits of Delta 5, or is this intended to totally replace something that we rarely get or no longer get in our diets?
That's a great question. If you look back at the traditional diets, the American Indians and the usage in traditional Chinese medicine and so on, we ate quite differently thousands of years ago, or even hundreds of years ago. We used to eat a lot more small mammals, and these small mammals were then eaten by other animals, and there was an accumulation effect there. And also, we were eating things like maybe minks and these small hunted animals, and those animals would have been consuming themselves berries, junipers and pines of the like, and would have had some accumulation of skiadonic acid. So, it's my working hypothesis for that reason, and also let's take an animal like deer that used to be free grazing and going around, or still are free grazing, but going around and consuming junipers and berries and so on, and they're accumulating it too. So due to the changes in modern agriculture and the way we eat it, it's my hypothesis that we consume less skiadonic acid than we once would have. And so the answer is you can get some skiadonic acid back in the diet, but it's not very practical to eat the way I just described. So I think what the future holds is companies like ours, who are the world leaders in this technology, to add skiadonic acid to skin formulations, and also eventually for oral use and possible drug use in the future.
Right. Well, Dr. Berger, it's been a pleasure. Thank you for giving us this information. Where can we go online and learn more about Skiadonics Incorporated?
So skiadonics.com is the website, and Skia Essentials is the website to purchase the commercial products for the skin.
Great. Thank you so much for joining us today.
Thank you so much.
Transcripts and audio of this program are available at healthprofessionalradio.com.au and also at hpr.fm.